Alrighty. Hello and welcome, everyone. I'm Nuri from the Massachusetts Health Connector. I'm joined by my colleagues, Nikki and Melissa, who will be presenting today's information. Together, we are here today to share information about open enrollment for plan year 2024, whether you're considering changing health insurance plans for the upcoming year or enrolling in coverage for the first time. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, we just want to share some information about our presentation format. First, everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes. Then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen, and we will be monitoring your questions throughout the webinar. We ask that you please do not share any personal information or private health information when you ask your question, as others on the call are able to see what you write. If you have a personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from a local assister. We are recording today's webinar, so following today's session, you'll receive an email with the presentation, so there's no need to take detailed notes. And now that I've gone over a few points regarding formatting, I will hand it over to my colleague, Nikki, who will kick this off.
Thanks so much, Nuri. And again, thank you everyone for joining us today. We have a large group of folks, so as we are going through the presentation, there are 5 sections to today's presentation, and as we're going through, we'll just pause for a moment to take a question or two after each of these sections, just to make sure that people are understanding the concepts that we're stepping through. And also, as it's December 21st, we really want to make sure that you're getting your questions answered so that if you're seeking coverage or you're helping someone who's seeking coverage for January 1, you know what you need to do next. So these are the sections that we'll be covering, and I'm just going to dive right in and start with what is the Health Connector's Open Enrollment. So some of you may be familiar with the Health Connector and what we do, and others, this may be the first time that you're hearing about us. So what I just want to convey is that we are the state's health insurance marketplace. So with that comes a number of things. I will go over, what that means in Massachusetts specifically and what you can expect from our plans. But in general, you might be wondering who gets health insurance coverage through the marketplace. So we are here to offer coverage for individuals, families, and small employers. A lot of folks who come to the Health Connector and apply for coverage also are able to save dollars through advanced premium tax credits. We'll talk about that. We'll talk about the qualifications. And again, we'll be able to answer these questions about all of these concepts as we're going. So because we're the state's health insurance marketplace, all of the plans sold through the Health Connector meet both state and federal coverage standards. So all of our plans are known as qualified health and qualified dental plans. So as a consumer, what do you need to know? You know that you can rest assured, you know that you're going to be enrolling in comprehensive coverage. And based on where you live in Massachusetts, you're going to be offered a variety of plans by the health insurance carriers that are available in your area. Now, I've already mentioned savings through advanced premium tax credits, and I'll go over this in more detail later, but essentially, the Health Connector is the only place that if someone qualifies for advanced premium tax credits, they can receive those. And those tax credits would reduce your monthly premium. Now, unique to the Health Connector, unique to Massachusetts, is a program known as ConnectorCare. And basically, people who meet other eligibility requirements may now, qualify for low or no cost health insurance coverage. in a few slides, I'll talk about what's new for 2024, but essentially we're able to offer more savings to more people this plan year. So let's talk a little bit about what open and closed enrollment means. As you can see, open enrollment runs from November 1st through January 23rd. So people who are seeking coverage for January 1 need to take action in advance of January 1, and the deadline is December 23rd. Now, after open enrollment ends on January 24th, we are in a closed enrollment period. So January 24th through October 31st. And I'll explain what that means. We don't want anyone to be concerned. There are still opportunities to get coverage during closed enrollment, but right now is the easiest time. So talking about open enrollment a little bit more, it's the time of year when you can apply for new coverage for the coming year. If you're a completely new applicant, or as a current member, you can renew your coverage that you're currently in, or you can change. You can shop around and change the health insurance plan for January 1. Now, what's great about this time frame, and this again happens every year, you can check and see what's available in my area to me that starts on January 1. Now, from a health insurance perspective, we want everyone to understand that Health Connector coverage begins on the first day of each month. And again, which I had stated before, but you're going to hear me say this over and over again. If anyone is looking for coverage that starts January 1, you need to apply, enroll, and pay for that coverage by December 23rd. Now, you might be wondering, okay, I mentioned open enrollment goes through January. And if someone misses this December 23rd deadline, they can certainly continue. They can shop in January, but their coverage is not going to be effective until February 1. Now, I want to talk about special enrollment periods because in previous presentations, people have asked a lot of questions about this. I want to explain. When we are in a closed enrollment period, someone can still enroll in or change health insurance plans, but only if they have a qualifying life event. So you may be wondering, like, what are these things? So it could be that you've had a change in your household size. Maybe you've had twins, or maybe you had a tax-dependent child who's now on their own, or your income has gone up or down. Immigration status may have changed, or you may have moved from one part of Massachusetts to another. So these are just examples, and there's a long list of what would be considered qualifying life events. But essentially, when something happens and you're interested in modifying your health insurance coverage, you need to report that qualifying event within 30 days of it happening. And then you have 60 days from the date of the qualifying event to select a new plan if you want to make a change. Now, as you're going through this, payment and enrollment deadlines still apply. But again, this is just to assure you that you are still able to get into coverage or change coverage when these types of things happen. Now, Nuri, I just want to pause here for a quick second to see if there were any questions yet that you want me to cover. And if we don't, it's okay.
Yeah, sure, Nikki, thank you. We have lots of good questions already coming in through the Q&A. I know you gave a little bit of background on the Health Connector, but do you just mind providing a quick explanation for folks who might be looking to apply and whether or not they can overlap coverage with Mass Health? I know you didn't talk about Mass Health, but if you don't mind addressing that, that would be great.
Yep, not a worry. So the Health Connector and Mass Health are two separate organizations. However, we have a very close relationship. We like to say we're sister agencies. However, the Health Connector and Mass Health, although we're separate, we do share a common health insurance application. And that's the online application at mahealthconnector.org. So if any of you have already applied for coverage, you would see that you'd be getting mail from the Health Connector. You'll also be getting mail from Mass Health. And that's because we are legally required to let a person know, since both of our organizations use the same application, we're required to let you know that you either qualify or don't qualify for our programs. So I know it can be a little bit confusing, and I think some people also just think of the Mass Health Connector as if we are all one thing. So apologies in advance, but Mass Health is the state's Medicaid agency.
Thank you, Nikki. And I would like to just ask one more question, since you did touch on special enrollment periods and then open enrollment, closed enrollment. So if an individual, let's say, wants to apply for coverage at a later time because for some reason at this time they're already covered, can they do that outside of the open enrollment period and change their coverage, or would they need to do it specifically now during this period or qualify for a special enrollment period?
This is a really great question. So if somebody doesn't want to take action right now for whatever reason, it's important to remember that you have to have a qualifying life event in order for a special enrollment period to open. So as I went through here, things like if somebody moves, or you get married, or you adopt a child, have a child. So there needs to be a reason. So I think that's why we encourage everyone right now to take action, because during open enrollment, you don't need any special reason. You can come in and you can shop for coverage. Something I didn't mention, and I probably should mention, is if someone loses access to employer-sponsored coverage, either your own, or let's say a partner is a spouse's, that's a qualifying life event as well. So yes, I can see if someone's planning ahead and thinking, okay, I'm covered right now, but I'm not going to be covered in 2 to 3 months. I want to also just acknowledge, like, losing coverage from either someone else's job or losing coverage that's offered through a spouse, partner, etc., is also qualifying event.
All righty, thank you, Nikki, and we can move on to section 2.
All right, great, thanks so much. Okay, so let's talk about what needs to be done during this time in the deadlines. So all of you are probably thinking, we've heard the deadlines. I keep saying the deadlines, but you'll keep hearing me talk about December 23rd. And then again, I'll talk about all the different places you can get free help to move forward. So this slide is a really good segue based on what we had just talked about. This about us and our relationship with Mass Health. This slide is showing you an image of the Health Connector application landing page. But notice in the corner, there's a Health Connector logo, there's a Mass Health logo. So this is where a Massachusetts resident, if they're looking for health coverage, this is where you want to start. So whether someone is an existing member, or you're newly applying, or even if you had applied at some point before and you haven't taken the coverage, this is where you want to come back to. Now, if you are just starting this process, you want to go down to the bottom and you want to click on Create an Account. If you have been here before, you want to click on Sign In. And once you sign in, you're going to enter your username and password. And if you don't remember those things, because honestly, we all have many usernames and passwords now, you can use the forgot your password process. I also want to acknowledge this application is available to use in English, Spanish, and Portuguese. And as I had said before, this is one application. You don't need to know what you're applying for at the outset, but if you are looking for coverage, you need coverage, you just complete this application. If you are looking for help paying for that coverage, you indicate that. And it's one application for Health Connector, for Mass Health, and essentially this application in real time sorts that out for you. So before I move on, I just want to explain what I mean by real time. If you complete an online application and you get all the way through this application in a sitting, you will get an eligibility result. So again, we'll talk about this more, but I just want to acknowledge that this online application lets you know right away if you are in fact eligible for coverage. So, okay, so I mentioned I was going to talk about deadlines and actions you needed to take. So whether you are an existing member or newly applying, there are certain things you're going to need to do right now. So we are encouraging people to either update or submit your application. So if you've ever had an application with us, please don't create a new one. Just go in and locate your existing application and either report any changes, update items, update your address. Keeping up-to-date information, especially your updated contact information, is really critical so that we're able to get communications out to you. Now, if you're newly applying, you would need to complete and submit your online application. And then after you've done that, you've taken those steps, you can review your eligibility to see if you're eligible for savings. So as I said before, this application gives you a real-time eligibility. What does that mean in regular words? It just means that you'll know right away, like, what does, am I eligible for the Health Connector? Do I need to submit proofs of income, etc.? So if you need to provide us with any documentation, you'll get a list of that at the end on screen, and you just need to submit that by the deadline that it's requested. Now, I left out a big step in this, which is step 3. We need you to not only complete your application and answer your questions, but once you know what you're eligible for, you need to shop, compare, and enroll in a plan. So, as I had mentioned previously, you want to compare the plans that are available. If you owe a monthly premium, you need to pay that by December 23rd, and your coverage can start on January 1. Now, what if you're newly applying? What is it that you would need? What are the eligibility requirements? You need to be a Massachusetts resident. You need to be lawfully present in the US. So are you a US citizen, US national, or otherwise legally here in the US? And you need to be someone who doesn't have health insurance. So if you have access to health insurance from another source, such as you're already enrolled in Medicare, you're already enrolled in Mass Health, which is our Medicaid program, or you have some other type of public health coverage, you will not be able to qualify, because essentially that coverage is available to you. Also, if you're offered affordable, comprehensive health insurance from an employer, whether it's yours or your spouse's, you won't be able to get savings through the Health Connector. Also, if someone is incarcerated. Now, what kind of information do you need to sit down and take these next steps? You would need to gather Social Security numbers for everyone who's applying. If there are any immigration documents, you want to gather those materials. If you need some help, like identifying a particular immigration document, we have great resources on our website, and they'll help you. There's a lot of visuals that can help you identify exactly what you might need. And then in terms of income information, we're going to need information about recent pay. So if you are employed, copies of your last 2 pay stubs. If you're self-employed, information regarding your net income. If you're unemployed and you're collecting unemployment, we need to see the information from what's known as your monetary determination. And as I had said before, if you don't have all the information required, we'll let you know what we need. We'll let you know that we need more information. You'll get a notice regarding that. Now, we usually get lots of questions about what types of income to include. Now, in the online system, you're going to be asked questions about current income and projected income. So current income is, what you're making right now. Maybe it's weekly, maybe it's monthly, but that's kind of like what's going on right now. Projected income is income from the entire year. So what that means is, if you've got income from employment, if you have income from Social Security, these are all the types, there's a list here on the right-hand side. These are all the types of income that you want to include. Now, you don't want to include child support. You don't want to include any dollars that you're getting as a gift. If you're receiving supplemental security income or SSI, that does not need to be included. Also, you don't need to include any dollars that are taken out from an employer for childcare, health insurance, etc. And you'll see these items, if these are being taken out of your paycheck, you'll see it listed on your paycheck. Now, after you apply, right, this is all great, you've completed your application, what is it that you need to do? I've already mentioned that we would be sending, if we needed something more, you'll see it on screen, or we'll send a notice. Again, if you're required to send in, if we're asking for documentation, please send it in within the required 90-day timeframe. Now, you may be wondering, okay, so what happens if I apply right now and my life changes in like 2 to 3 months? And basically, you just come back to your application and make updates to it. And the reason we want you to keep this application as up to date as possible is it's really going to help you get the most amount of help that is available to you, and then have you have a lower risk of owing money to the IRS when you file taxes. Now, I will spend some more time talking about advanced premium tax credit so you can understand, what that means and kind of how you don't need to take the full amount that you are eligible for. You actually have an opportunity to adjust that amount. And actually, I'm just gonna, my colleague Melissa, when she shows you how to get an estimate, she'll show you a sample person or a sample couple, and she'll talk about a dollar amount. And keep in the back of your minds that if you were that person, you could actually decide to take a lower tax credit if you know that your income's going to go up or down. Okay. And Nuri, how are we doing for timing? Is it okay if I take a question here, or would you prefer I kept going?
I think a question at this point would be great, Nikki, particularly related to the different deadlines that you have mentioned. You have mentioned a December 23rd date, and then you also mentioned an open enrollment period date. So would you just mind touching again on these important dates and clarifying what either existing members or new members can do during these 2 dates? Seems to be a little bit confusing to folks.
Okay, absolutely. Thank you so much. So, okay, right now it's December 21st. So whether you are an existing member, well, actually, let's take them separately so that there's no confusion. If you are an existing member and you have reviewed your eligibility, you've gotten a bill from the Health Connector, if you are comfortable and you want to just proceed, you actually don't need to do anything but pay your bill by December 23rd so that your coverage is effective on January 1st. So that is if you are an existing member. However, if you're an existing member and things have changed in your life and you're looking at your bill, or you are saying, well, is there a way I can maybe just save some money? Like maybe this doesn't suit me anymore. The first thing we ask is that you go into your application and update it. Go through page by page and just make sure all of that information is up to date. And then you'll be brought to an area where you can make a change. You can shop for a different plan if you want to enroll in a different plan. Again, if you want all of that to be effective for January 1, you need to complete all of these actions by close of day on December 23rd. Now, if you are newly applying and you're seeking coverage that starts on January 1, same kind of rules are in play. You got to take all of your actions, meaning complete your application, choose your plan, pay for that plan by December 23rd. You can get into coverage on January 1. Or if you decide to take action in the month of January or the 24th to 25th, 26th of December, you can enroll in coverage that starts on February 1. Does that help, Neri?
Yes, it does, Nikki. And not sure if you'll be sharing this later on in the presentation, but let's say I'm worried. It's December 21st and it's on a Saturday. That's coming up very quickly. Like, what should I do then to complete my application, make sure I have everything aligned?
Yeah, so I probably should be saying, don't worry, there's still time. Do not worry. So our customer, we will go through this and we'll show you all the phone numbers. Even if you're anxious right now, you can go to mahealthconnector.org. On our homepage, take a look, go to the help section, look at the contact center details. We have extended hours for this evening. We have extended hours for Friday, during the day, Friday into Friday evening. And then we're also open for a number of hours on Saturday, which is the final day. So if you want or need customer service support, it is available to you. But in addition to that, I'll talk about other local supports as we get further into the deck.
Thank you, Nikki. All right, for the
Yeah.
sake of time, let's keep going.
Yep, absolutely. But I guess the message is there's still time. And that's why we're doing this presentation today for you, because we know people are interested. They still want to learn about this. They still need to take action. So I just want to talk a little bit about what's new for 2024. So I briefly alluded to this, that basically we are expanding eligibility for the ConnectorCare program. So what does that mean? That means there are going to be even more people who are going to qualify for these subsidized health insurance plans, which have low copays and no deductibles. So this ConnectorCare program is, it's designed in such a way so that we're able to keep the cost more manageable for consumers because we're combining federal and state dollars to offer these lower monthly premiums to folks. So if someone isn't eligible for the ConnectorCare program, they may still be eligible to qualify for advanced premium tax credits, which lower someone's health insurance bill. And let me just talk about that. Let me just talk about that a little bit more so that you understand exactly how these work. Now, I mentioned APTCs, just for short, lower the premium amounts someone pays each month. So the way this works, the IRS is going to send that tax credit that you're eligible for directly to your insurance company. So you as a consumer just simply pay less each month. Now, let's make pretend I'm going through the application and I find out that I qualify for $500 a month of tax credit. And I might not be comfortable with that. I can decide to apply, not apply 100% of those dollars. I can decide to reduce the amount of that tax credit. And as I said, my colleague Melissa will talk more about that, and she'll show you exactly how you can see what you qualify, what that tax credit is. Now, I've already mentioned how we keep the cost for the ConnectorCare program low. But I think it's important for me to mention that in ConnectorCare, people qualify for different plan types based on their income and their household size. So that there is an opportunity to enroll in the lowest cost plan. So some people can enroll in a plan that is going to be $0 a month, and then others can enroll in a plan The lowest cost plan in that like highest tier, if you will, of income is $255 per month. And I'll show you an example of that in a little bit. Another exciting development for 2024 is that all health insurance carriers and companies who participate on the Health Connector are going to be offering ConnectorCare plans in 2024. So in addition to Fallon Health, Health New England, Mass General Brigham Health Plan, Tufts Health Plan, and WellSense Health Plan, you'll also see ConnectorCare plans from Blue Cross Blue Shield of Massachusetts, Harvard Pilgrim, and United Healthcare. Now, all of these changes will take effect on January 1. So as you get an estimate right now, you can see that these options are visible again, depending on where you live. So you might be wondering, what does this mean in dollars and cents? So for an individual, this increase of savings or increase of subsidy means moving from $43,470 to $72,900 for 2024. So that means if someone's income as a single person is, in the $50,000 range, and they meet all the other eligibility requirements, they could in fact qualify for ConnectorCare. Also, if there's a family of 4, this income limit increase moved that family of 4 from $90,000 to $150,000. So if that family of 4 is making, just under $150,000 a year, they could also qualify for ConnectorCare. And this table just details things a bit further. So I mentioned that based on somebody's income and household size, they are grouped into plan types. And you'll see here that every plan type has a lowest cost plan. So for example, the lowest cost plan in plan type 2A is $0. Lowest cost plan in plan type 3B is $142 a month. So that's essentially kind of what this means. And then also you're seeing 3C and 3D. Know that these are our new plan types for 2024. How we doing, Nuri? Do we want to take another question?
Yeah, so you mentioned the different income levels. I guess going back to the previous section where you talked about different incomes. So for a household, how do you determine which incomes you should include in an application and to determine where you fall in, let's say if you're eligible for a ConnectorCare plan?
That is a really great question. I'm glad you asked that. Someone asked that. Basically, what the Health Connector is looking for is your tax filing household. So we would want to, you would want to, or need to include anybody that you include on your tax filing. So if you have a dependent child, or you are married. I also should mention, if you are married, you do need to file, in order to receive tax credits, you and your spouse need to file taxes jointly in order to get these savings. I also think it's important to mention that if someone is a survivor of domestic violence or facing spousal abandonment, there is an opportunity for you to also receive those tax credits. You don't need to, include this other person on your application. So there is that exception there, of course. I hope that helps, Nuri.
Yes, it does. Thank you, Nikki.
All right, I am going to try to get through this next couple of slides so that we can get to the really good stuff, which is, I always think Melissa gets to do the really good thing that you guys really want to see. You want to see, how is this done? All right, so before you enroll in coverage, what are the things you need to consider? So this is actually helpful whether you're shopping on the Health Connector or you're shopping for coverage in general. These are components of health insurance. So there is a premium, a monthly premium that people pay each month. So I like to sometimes think about this as a gym membership. This is what somebody pays, and whether they use the services or not, whether they go to the gym or not, these are dollars that they're committing to invest each month. Now, as part of the health insurance plan that you choose, there are going to be a set of covered benefits, and these are all the services that are covered by that plan that you enroll in. Now, there are out-of-pocket costs that you need to consider. So if you are picking up prescriptions, or you're visiting a specialist, or you need to get an MRI, there's going to be an amount that the member pays for each service. So you may need to meet a deductible before your plan kicks in dollars, or you may need to pay a copay to see that specialist. Really important, the ConnectorCare program does not have any deductibles. So that's really not, a deductible isn't something that you need to think about, but there are slight copays for medications and other services received. Now, lastly here, in network. A network really is all the doctors, specialists, hospitals, everybody that plan that you've enrolled with is contracted with. So we'll be seeing, if you're looking and you're shopping for coverage, it will give you information about, everyone who, is in network. And then if you need to go out of network, it will provide you with some information about what that would entail for you. All right. So you might be wondering, okay, I need to understand what these pieces are, but then how do I shop and compare? So whether you're you're newly applying for coverage, or you're an existing member, you can come to mahealthconnector.org/renew. And all of the different tools that you need to look for are going to be available there. So Melissa, I won't spend a lot of time here because Melissa is going to take you through all of these tools. But what I will say is that there are tools that you can use right now, and then there is a tool that's useful and you're able to access only when you're in the application. So Melissa is going to give you a demo of how to use the Get an Estimate tool, and also how to use the Plan Comparison tool. Now, the Get an Estimate tool lets you see the plans that are available in your area, and it gives you an estimate of all the savings that you may qualify for. Now, the Plan Comparison tool lets you see which doctors, which hospitals are part of a specific plan. Are they in network for that plan that I'm interested in enrolling in? So again, Melissa will go through that. Now, when you're in your online application, there is a Plan Finder tool, and it really lets you see the same things that Plan Comparison does. You can search for a doctor. You can make sure a hospital is part of your health insurance plan. And you're also able to see the monthly cost. And this is the exact amount, because this is based on all of your information that you would need to pay in order to be able to enroll in that plan. All right. So I feel bad. I'm going to have to talk about deadlines again. So enrollment, billing, and payment. So actual enrollment is not complete until the premium payment has been received and processed. So again, if you're seeking coverage for January 1, you've got to take action over the next few days. You need to be complete by December 23rd. The Health Connector, if you were an existing member, the Health Connector sends the bill for January 1 coverage during the first week in December. So you should have already received a bill. And this bill is going to be based on your final eligibility determination, which means it's the final decision based on all the information that we have in your application. Now, if you're an existing member and you switch plans, You can still do that. It's just not going to be reflected in the bill. It will be reflected online. And remember, if you've got a bill that you're like, well, this is just not right for me for next year, etc. Please just go into your application, review it page by page, make sure we have the most up-to-date information for you, and you still have time to shop and make a change. Now, on the right here, you're just seeing what looks like a sample bill. And I want to just acknowledge that there are a number of different ways that you can make a payment. Our preferred method is to pay online, and you can pay using a checking or savings account. You can also pay by mail, and we have a newer pay by phone option. So if you want some more information on how to make a payment, the link is mahealthconnector.org/how-to-pay. Now, Nuri, do you want me to go into the getting help section, or do you have something you want? It's totally up to you.
Actually, I think you might answer this in the getting help section, but it's related to the application itself, the online application. For any advice that you have for members who are struggling because there's an application already pending, or they're locked out of their account, or whatever other technical issues that they're facing, possibly related to like inputting effective dates, etc. But particularly logging in. Let's start there, and then other technical issues that members might be facing along the lines.
All right, that's really good. Thanks for bringing that up, because it's just in case I might have missed it saying it. What's really great about our online application is that if a consumer starts this application at home, and you only get so far, you can call either customer service, or you can call a local navigator organization, and with your permission, they can go into your account and they can help you continue through. They can help you get to the end of the application so that you can, choose your plan and enroll in a plan. Now, at the very beginning, if you're having difficulties logging in, and you know that there's an application out there and you've done this before, you can call customer service and just get some assistance. With, logging in if the forgot password isn't working, etc. Now, if you are someone who's completed an application, or someone else, let's say a navigator or another type of enrollment assister has helped you complete an application, but you yourself never had an online account, you can call our customer service and you can ask them to send you a link to your account. And then you'll be able to use that link through your email and you can access your application. But essentially, all of these folks are able to help you move forward. So we don't want you to feel like you're stuck in limbo and you can't move ahead. They can actually all help you move forward.
Alrighty, thank you, Nikki. And just one more question. I know we have to do getting help in the demos, but for folks who are wondering if they can update their application again after, let's say January. So let's say I have coverage now, I want to update my application in February or March later on in the year. Am I able to do so?
Absolutely. You can come back in and update your application anytime. If you're expected actually to update your application within 30 days of something happening in your life. So let's say you lose a job, or you've gained a new job, or you're going to move. You can come in at any point in time and make an update to your application. Certain updates are going to give you the opportunity for another special enrollment period, but other updates, they won't. It just, again, is going to allow you to have an up-to-date application with us.
So is that the same for changing plans, Nikki?
No, that is not the same. It's really important to think back to you, and some folks might be coming in and out of this presentation, so maybe it's important to restate this. There is during open enrollment, which is now through January 23rd, people can shop for, and they can change plans. You don't need a reason. Outside of open enrollment, when we get into a closed enrollment period, in order to be able to change plans, consumers need to have some sort of qualifying life event. And things like getting married, having children, adopting children, or even like a child leaving the home and not being part of your tax household. That will all give you an opportunity for a special enrollment period. And we can drop a link in into the chat for someone to see the full list of qualifying life events. And I'm just going to really, really quickly mention, and because I've already talked about this, I've mentioned customer service, and I've mentioned community partners, I've mentioned navigators and other assisters. This is all free help, and it's available through customer service as well as through partner organizations across Massachusetts. This is our number for customer service, 877-623-6765. And all of this information, including detailed hours of operation, are available on our website at mahealthconnector.org. Community partners, I think it's just worth mentioning that they're all trained and certified by the state, and a number of people speak several languages that are reflective of the communities that they're serving. So if you are looking for help in a language other than English, you can go to our website and there's a link to get free help near you, and you can see. You can search, we can show you, maybe Melissa can demo that for you. So you can look for a navigator or another type of assister. Now, it's super important given today's date. If you want to see or talk to somebody in your community, it's best to call ahead and see if they have an appointment for you. But customer service, you do not need an appointment to call customer service. You can simply just reach out to them. All right. So without further ado, I'm going to see if my colleague Melissa can. Hi there.
Hi, thank you, Nikki.
Okay.
All right, so this is my favorite part because you get to actually see savings on this demonstration. So let me just share my screen. Give me 1 second. And hopefully everybody can see the screen. Okay.
Yeah.
Okay, perfect. Okay, so I'm going to do the get an estimate tool that we have. So if you don't want to do the application and you just want to see exactly how much you would be saving before doing that, you can click on get an estimate and hover above individuals and families and just click on that. And here we have our get an estimate tool. So you just want to answer a few questions regarding your circumstances. So of course we want to pick 2024 as the coverage year. You want to enter your zip code, and I'm just going to do a random zip code. You want to enter what you think your household income will be for the year, and I'm just going to enter a random number. And then I'm just going to say that there's one person that we want to see. And then the age of this person is, I'll just say 35. And then here on the side, on the right side, you notice you want to check off that this person needs coverage. And then there's two other categories here. If this person is pregnant, or this person is disabled or blind. So you want to consider those 3 questions. And then I'm just going to say that this person needs coverage, and I'm going to go to my results. And then this is just a reminder that this is not an actual application for health coverage, and that's fine. We're going to continue. We're just basically going to get an overview of the estimated eligibility. So for this person here, this 35-year-old household member, we see that this person would qualify for the ConnectorCare plan with an advanced premium tax credit. So this person would be getting a tax credit amount of $31, and they're eligible for silver plans with monthly premiums as low as $219. So we want to preview these plans. So we just click on preview plan. And then here we get more of a breakdown for this person. So you see here on the top that they are eligible for the ConnectorCare 3C. They fall in the FPL of 377.23%, and FPL is the federal poverty level. And then the monthly APTC, which is the advanced premium tax credit for this household, is $31. So again, as we had mentioned earlier in the presentation, the advanced premium tax credit is savings that you put towards your monthly premium costs. And this is also optional. So if you feel that you don't want to take advantage of this, that's also fine too. So then we have a breakdown. We have the carrier, plan name, coverage level, monthly premium, the APTC savings, the Massachusetts state savings, and what you would pay monthly. So basically what would happen here is you would take your monthly premium costs, and if you chose to do the APTC savings, you would subtract that, and that would actually be your monthly premium. So then you see here, if this is something that you would be interested in, you see that you're saving and you see the plans that are being offered. So if you wanted to apply, now that you see this, you can go ahead and apply. Or if you wanted to start over, maybe you missed entering somebody else in the household, you can start over and enter that information. So this is helpful to give you a brief overview of exactly what you would be eligible for. So now I want to go back, and I know that Nikki had mentioned in the presentation about our renewal page. So this is basically the renewal page, just basically indicating that you should enroll by December 23rd for January 1st coverage. So you have two options. You either are a new applicant or a renewing member. So I'm just going to click on renewing member so that you can see all of the tools that we have that we can provide you with. So if you scroll down, you have a few options here. So here we have review your 2024 eligibility and plan. And then we have an option here to compare changes for 2024. And then we have check providers and prescriptions. So this is another tool that I wanted to show you real quick. I'm going to click on this. So this is a great tool to have if you have a provider and you're trying to decide on what kind of plan to select. But you want to see if your doctor's in network with that plan. You also want to check to see if your prescriptions are in that network. So this is a really great tool. So individuals and families, and you want to click on continue. So you're just going to be asked some questions here. You put in your zip code. You say, yes, you did qualify for the ConnectorCare plan. And then what ConnectorCare plan type did you qualify for? And I'm going to say 3. And then I'm going to continue. So here I'm going to say that my doctor is, and this is just an example, Dr. Lee. So I'm just going to pick, you have a selection here when you enter just the last name. And I'm going to say, well, this is my doctor. I want to see if this doctor's in network. So I'm going to continue. And then I want to say, well, I go to Brigham and Women's Hospital. I want to continue getting care there. I love it there. So let's see if it's in network. So we want to continue. And then here, let's just say you have a prescription drug. You want to continue using that. So again, using this as an example. So I'm going to say Ativan. It's an oral pill. I want to make sure that the dosage and the strength is what I use. So I just click on that as the example. and then I want to compare plans. So these are the plans that are offered in my area. And so we have Mass General Brigham Health Plan, we have Tufts Health Direct, and we have WellSense. So again, we want to see if the prescription drug is offered and is in network with these plans. So if you hover above here, so the category for your drugs, and then we hover above C list, we see that this drug that we entered is not in network. But, and also the doctor isn't listed here. So that means that the doctor is also not in network with this plan. But we see that the facility actually is in network, Brigham and Women's Hospital. So based on, some people have a great relationship with their provider, they want to continue with treatment. So you would have to actually, say to yourself, should I pick this plan and give up my provider, or should I keep my provider and pick a different plan? And that's your preference here, but you can kind of go with either Tufts, I'm showing that this provider's not in network. And I'm also seeing that the prescription's not in network and the facility is not in network. And also it looks like the WellSense, the same thing. So you kind of have more of a way to make a more informed decision on which plan you would like to select based off of this information here. So I am going to go back to the renewal page. And I'm just going to scroll back down. So just a quick reminder here, you can shop during our open enrollment time. This is how to sign into your account. Just going to click on that real quick and just briefly go over this. I believe Nikki went over this earlier, but this is the application page. So you want to sign into your account with your login information, or if you are a new member, you want to create an account. So that was just a quick reminder. And then if I go back to the renewal page, also, you want to make sure to keep in mind that the payment due date is the 23rd of each month. So for example, if you paid by December 23rd, your plan would take into effect January 1st. So you want to make sure that your payment is received by the 23rd of each month. And that concludes the demonstration.
Melissa, before you stop, because you've got your screen up, would you mind just showing people the customer service? So if you scroll up to the top of the page, I can't see all the things. I think it says Help Center.
Sure.
If you click on that and you click on customer service, I just want to point out for people that if you scroll down, I think you're going to be able to see the extended hours. So yeah, so I'll go back up a little bit.
Oh, sorry.
No, that's okay. So today and tomorrow, customer service is open from 8 a.m. to 8 p.m. And then, Nuri, is it okay if she just shows people how to find local help too? So if you go back to that same location you were, the same menu, I don't even know the words anymore, I'm so sorry. The menu tab helps that,
yeah.
and click on Find Local Help.
Sure. No. Sorry, I don't know what happened to my screen.
Can I ask a question then? Well,
is that once you choose to enroll in COBRA, you are committed to COBRA unless it's open enrollment. So right now, if you are someone who has been in COBRA and you're like, yeah, I need to get out of this, you can certainly apply, look for coverage, stop paying for your COBRA, end your COBRA, cancel it, and then come to take your coverage through the Health Connector. But if you are someone who got COBRA and then like your employer was offering you a certain amount of money, you'd be able to, once that money ran out, let's say they were going to pay for COBRA for about 6 months, you would be able to come to the Health Connector when that subsidy ran out. So when that 6-month period ran out. So it's really dependent on your personal situation. But if you call customer service or call one of our local assisters, they'll be able to talk you through your personal situation. And Nuri, I noticed that it's just after 1. Is it okay if we take a couple more questions? But I want to be respectful of people's time, and I see that we do have a lot of people still on with us. So,
yeah, Nikki, I think it'd be great to touch on the next topic here. Regarding out-of-state coverage. So if someone needs a plan that offers coverage in a different state for non-emergency services, for an example, do you recommend that they go directly to a carrier? Should they use some of the resources that Melissa walked through? Any suggestions there?
Melissa, help me with this one. So I know for certain ConnectorCare plans cover emergencies outside of state, but I don't believe regular physicians are in network in ConnectorCare. But if somebody were shopping and they enrolled in coverage and they received APTCs or they were just buying a Health Connector plan, I think it's going to be dependent on the type of plan that they enroll in. But I'm fairly certain ConnectorCare plan does not cover out-of-state routine care.
Yes, you are correct, Nikki. And it actually states that in the application that you must reside in Massachusetts in order to be eligible.
Okay, great. Thank you.
Sure.
And Melissa, is it fair because I think Nuri, you're deciding, is it fair to say that if somebody lives like part of the year in another place, as long as they're a Massachusetts tax filer, if the majority of the time I'm a resident of Massachusetts, I can apply for this coverage?
Yes, definitely.
Okay.
All righty. I'll try to do a rapid fire round here of questions. So for individuals who are, let's say, nearing the age of 65, but not necessarily there, should they still apply for coverage? I mean, or should they wait until they're 65 to get on Medicare possibly, or what are the options there?
Yes, don't wait. If anyone on this webinar needs coverage, please don't wait. Just get an application started. If you need help, really reach out to customer service or even a local assister. Or if you are over 65, there are folks who are known as Shine counselors, and they can help counsel you. But up until you are 65, you can still apply for Health Connector coverage. And keep that Health Connector coverage until you become Medicare eligible. And then you would drop your Health Connector coverage and go to Medicare.
Right. Alrighty. Any words for folks who are eligible for employer-sponsored insurance for themselves as individuals or families, but let's say it might be too expensive in
Melissa, I'm going to let you take this. Sorry, Nuri, I'm cutting you off. Melissa,
no,
you
I
go.
just said in their opinion.
Okay, thank you, Nikki. So if the person had employer-sponsored, had access to employer-sponsored and it was too expensive, then yes, you could actually still apply to the Health Connector and see what you would be eligible for.
And the application's going to ask for a lot of detailed information about the employer sponsored insurance, or ESI. But you just need to enter all of that information accurately, and then the system will make a decision. But it's not necessarily information you'd know offhand. You may need to go to your employer and ask them to help you respond to these questions so that you, in fact, could be eligible for a Health Connector plan with some help.
All right, thank you. And are there any potential tax implications if a person receives a healthcare subsidy or an advanced premium tax credits?
Yes, so from a tax perspective, these APTCs are tax credits. So you're getting them based on the income that you've entered on the application, saying that that's the income you made. So if you underestimate your income and you get, let's say, a bunch of tax credits, I'll just use the word a bunch. Now, as the year goes on, you actually made a lot more money than you thought you were going to make, but you didn't come back to update the application. When you file your taxes for the previous year, you may find that you actually owe dollars to the IRS. Again, these are federal tax dollars that are coming to you, and everybody, when you're going through the application, you're going to be asked that are you willing to file taxes? Are you going to reconcile any tax credits if you receive them? So this is very much, these are federal dollars coming to you based on the information you're providing.
And can I just chime in real quick?
Yes, please.
Also, they're optional. So if you feel that you don't want to use the advanced premium tax credit, you don't have to use it. Or you don't have to, you can use a partial amount. There's like a little thing that you can scroll to pick the exact amount that you want to use towards your monthly premium costs.
All right, thank you. Okay, if we ask one more question. Okay, so I had not. For any Mass Health members who might be in the audience at this time, do you have any advice for them as to what they should do to keep their Mass Health coverage, or maybe they're losing their Mass Health coverage? What do you recommend then?
So if any folks are here and they're Mass Health members, Mass Health is going through a major renewal, which basically means all of the people who are part of their membership have to update their applications so that you can find out, so that the person can find out, do I still qualify for Mass Health or do I no longer qualify for Mass Health? So if there are current Mass Health members here, I would suggest you take a moment. It's the same application that we were showing you and talking about. I would update that application. Make sure your contact information is up to date. And after you update the application, you're going to see that determination as to whether or not you still qualify for Mass Health, or you could be newly eligible for a Health Connector plan. So if you, Mass Health is doing a major push and mailing out blue envelopes and sometimes white envelopes. If you haven't received that envelope and you're still a Mass Health member and you're like, oh, should I go in now? I would suggest you call Mass Health and just make sure all of your contact information is up to date, because you don't necessarily want to, if things haven't changed, you just want to make sure Mass Health is able to get in touch with you when it is time for your renewal. Nuri, Melissa, does that feel right to you? Is that how you'd, okay, great.
Yes. All righty, and I do say that we are 10 past 1 now, so if you guys have any final words for our audience members here, any key reminders that you'd like to share?
Yes. Remember that there is still time. If you need health insurance coverage, please take the next steps. Know that there are lots of people who are available to help you. Don't hesitate to call our customer service or even a local assister. Again, with the local assisters, I would just call ahead, but you do not need an appointment to contact customer service. So I really just want to thank everyone for taking their time. I know it's a busy season. I'll hand it over to Melissa because she always thinks of something else.
Yes, just definitely feel comfortable with the application process, making updates to your application as we go throughout the year. Things can change at any time, but if there's any confusion regarding that, please feel free to reach out to us. We are here available to you. And we also have our language line. So if you feel more comfortable having an interpreter call you, that's also an option to you as well. So please feel free to reach out at any time. We're here to help.
All righty, thank you. And I think that getting help, I mean, that goes for any questions that were left unanswered. I know that there were tons of great questions in the Q&A, and unfortunately, we don't have time for all, but please do reach out for help. And just a reminder to folks that the presentation, as well as the links that were shared and phone numbers that were provided throughout the presentation, will be distributed via email. So if you were unable to write that down, no worries, that'll come to you soon in your email. Just check your inbox. Alrighty, so that being said, we thank you all for joining today's webinar, and from the Health Connector and all of our sisters across the state, we thank you again, wish you well, and happy holidays.